All right, I caught the post match presser yesterday after the last game of the round for the NRL, Roosters Raiders, and I saw that Angus Crichton injured his knee. Trent Robinson talking a bit there now.
Yeah, I can see it now.
All right, let's play.
It was an MCL, so I think it was the short dropout. I don't know. He just got hit on that short dropout, I think. And then it just, I thought it was half time. It was so, it's disappointing for him. So I guess 246, depending what grade it is, Get Suoliti back next week.
All right, a few little indicators in what Trent Robinson's saying there, Paul. An MCL for Angus Crichton. Can you take us through an MCL injury?
Yeah, so MCL, medial collateral ligament, just one of the sort of stabilizing ligaments in our knee. It sort of sits on the inside of your knee and just helps with sort of some change direction, resisting a bit of contact in a particular direction. Interesting, he said it sounded like he just got a knock or he got hit off the short dropout. So it sounds like more of a contact injury. So someone's probably tackled the outside of his leg and just caused it to buckle in and just stress that ligament. Obviously, it can also happen just non-contact as well, change of direction, trying to step someone, just lose a little bit of that stability and can, tear that ligament.
Yeah, a key word he said there at the end, he said it was a little bit loose, like looser than they expected. So when they're referring to looseness, they're talking about the laxity on those stress tests that when you're stressing a ligament. So probably suggests, what do you think, a higher grade than what they initially thought? Because usually can play through a bit of lower grade stuff, but what are you thinking there?
Yeah, well, it sounds like they kept him on until half time by the sounds of it. So physio's obviously done the test on field and didn't think it was too loose. And they've retested at half time and obviously felt a bit of that laxity. So sounds more like a grade 2, grade 3, probably indicating, a longer return to sport again for him.
Yeah, and what will that look like for him? You think he said the journo's saying, will that be a month? And he's like, could be 2, could be 4, could be 6, you don't know. Obviously, he'll probably go for scans and see what the MRI results say in conjunction with his testing from the physios and that. What are you thinking in terms of time frame?
Yeah, so if it's the fact they've said loose, I'd be thinking at least 4 weeks, probably a grade 2. You're looking 4 to 6, and then grade 3 even longer potentially. So for him, he's probably spending today in a range of motion brace, your hinge ROM brace. I imagine he'll be in that for a good couple of weeks, unless scans indicate otherwise. I think we were saying that he does have a history of MCL, so whether it's the same knee and he's already got a little bit of laxity there, hard to know. Obviously, that's for the physio to decide. But, I think he'll be on just some rehab for the next little bit. So a bit of straight line stuff, a bit of gym work.
Yeah, I think also then if they're expecting a little bit more laxity, a little bit more instability to that stress, you kind of think, is there any other concomitant, any other kind of injuries that within the knee joint itself that may have happened? The fact that he kind of continued, I think I saw some tape on the knee. So the fact that he continued, I think maybe, who knows, he might be a bit up in the air and he might get away with a shorter, lower grade kind of sprain and then rehab period.
Yeah.
But the usual process in those first couple of hours, that initial phase post-injury is going to be pretty protective of it this next couple of days until they get more info and get it moving, get it settled, get the swelling down and see where he starts on the rehab ladder.
Yeah.
Seen many in the clinic recently for you and the MCLs?
None footy. I've seen a couple from soccer. We had one just from a big 50-50 tackle. So again, not necessarily the contact to the outside of the knee, but just enough of that force onto the foot that it's created that similar sort of torque on the knee.
Yeah.
And then we also had another change of direction from soccer. this year. So 2, but more lower grade. None that have needed a brace, just sort of grade 1s. I think 1 missed a week, 1 missed 2. So, nothing too sinister.
Nice. So that's Angus Crichton. It'll be interesting to see what comes of today, tomorrow, and see where that ends up. So we might keep an eye out for